Now, if you're feeling extremely low during perimenopause, menopause, you're not alone. I see so many women that come to me in my office with same symptoms and they feel helpless. And some women really have had extreme thoughts during this time because of the hormonal fluctuations. So why exactly does this happen? Now, women experience sadness and low mood during perimenopause and menopause, primarily due to the changes and eventual decline of ovarian hormones, especially estradiol and progesterone, which disrupt central nervous function and neurotransmitter regulation. Estradiol, so the estrogen, variability is strongly associated with increased depressive symptoms in perimenopausal women, and the absence of ovulatory progesterone actually makes the mood instability worse. These hormonal changes alter the neurotransmitter systems, including serotonin, dopamine, and GABA, leading to increased mood disorders and a vulnerability to it. During the menopause transition is increased risk of recurrent depression, and for some women that have never had anxiety or depression, they can develop it during this time. The risk of depressive symptoms is highest during perimenopause and tends to decrease after the transition to postmenopause. Now, other factors such as, not sleeping, hot flashes, night sweats definitely can affect mood as well as psychosocial stressors, which can make things worse. So the pathophysiology is driven by the hormonal and neurobiology changes that happen during this menopause transition. The latest evidence indicates that menopausal hormonal therapy, especially transdermal estradiol, with or without micronized progesterone, is helpful in reducing these depressive symptoms in perimenopause and in the early postmenopausal timeframe. Randomized control studies have shown that transdermal estradiol 0.1 milligrams plus micronized progesterone significantly reduces the incidence and the severity of depressive symptoms compared to placebo in the early menopause transition or with recent life stressors. Treatments like menopausal hormonal therapy in some cases, and of course antidepressants for those individuals that need them, can make a huge difference and give you your life back. So really important to discuss this with your provider and see if menopausal hormonal therapy is right for you, or if an antidepressant, right? Or it could be both. You may need both things, so there's nothing wrong with that. Sometimes if you have very low mood or if it's very severe, if hormones are not appropriate for you, then you can definitely be prescribed antidepressants, which can help with serotonin and improve mood, energy, and daily functioning. Both options are evidence-based, and the right choice depends on your overall health, symptoms, and your discussion with your doctor. So make sure you go and get checked out, and if you need help during this time, don't be shy to ask for it.